My name is Sarah. I work at Blue Cross Blue Shield of Massachusetts in Hingham as a nurse manager for the Medicare Advantage case management team. We deal primarily with patients who have gone into the hospital and come home. A lot of them are dealing with new diagnoses or new illnesses, new injuries, and they don't recognize how their nutrition can play a vital role in their recovery. We come across all different types of barriers when it comes to getting access to healthy, nutritious food. Those barriers could be financial. They're on limited budgets and they just don't have the financial resources in order to get those healthy diets in, healthy choices. We come across physical barriers, members who are homebound and they just can't get out of their house and they are bound to whatever a family member might be able to bring by to them. Or we're bound by educational barriers, patients who just don't understand what they should be eating in order to better their health. Medically tailored meals are extremely helpful because they provide the nutrition that the patients need when they need it. We've seen diabetic members, kidney disease members, all realize that their diets can be flavorful, can be nutritious, and have a lot of variety at the same time without having to compromise their disease process. We advocate for all of our members to try the medically tailored meals. We ask our members who are home with a new diagnosis of a cardiac illness or a kidney disease or diabetes to try them so they can have a physical example of what they should be eating so they can better their diet, better their disease process, better their outcomes. And we ask caregivers who might be stressed in the care of an older adult, parent, or loved one to try the medically tailored meal so they can take one more thing off of their to-do list for their caregiving duties. We have a member success story related to a member who had cardiac disease. And this member was an older gentleman and he lived alone. His cabinets were filled with canned soups and his freezer was filled with the bachelor diet of frozen meals. And this gentleman wanted to better himself, but he didn't know how. And he wanted to be able to incorporate healthy choices into his diet. We introduced the community servings meals to him, and he loved them. And he absolutely would call us once a week whenever they got delivered and said, "You know what they brought me today?" And he was just resounding with accolades. But in it, he would write down, "This is what they gave me, this is what I loved." And he took that education and he brought it to the grocery stores once the meal delivery stopped. And he knew, this is what I need in order to move forward and better myself, get stronger, recover, and prevent myself from having to go back into the hospital.